അടുത്തതായി ഷിക്കാഗോയിൽ നിന്ന് ഡോക്ടർ റോയി പി തോമസിന്റെ ഹെൽത്ത് ടിപ്സ്.
It is a moral and ethical teaching of all human societies, everywhere, at all times, that we should be thankful and grateful for the help we receive from others. All religions teach us that we should be grateful to God for all the blessings we receive in this life. Now, two research studies from two major medical institutions in America, University of California and University of Harvard, showed that an attitude of gratitude or thankfulness in life is good for our health also. Many leading experts agree that when we practice gratitude, it will have a lasting effect on our physical and mental health. Studies from these major institutions have shown thankfulness can lower our blood pressure and improve our immune functions. Gratitude reduces the lifetime risk of depression, anxiety, and substance abuse disorders. It also can be an important factor in preventing suicides. Practicing gratitude can affect our behavior positively. Grateful people engage in more exercise and have better dietary control and stick to the advice of their doctors. Living in the past, thinking always of the misfortunes we went through in life can make us depressed and our life miserable. Thinking always about the tomorrows and worrying about the future can make us suffer from anxiety. But gratitude makes us live happily in the present moment. Then we will value and appreciate our friends. We will become more thankful for the gifts and opportunities we have in life now. Then our mind will be happy with the things we already have and worry less about the things we do not have. One of the interesting things these researchers found was mind will also positively affect our body's biochemistry. Researchers showed that gratitude is associated with higher levels of good HDL cholesterol, lower levels of bad LDL cholesterol. Gratitude lowers the level of creatinine in the blood, which is an indicator of kidneys' health. It also lowers C-reactive protein in the blood, a marker of inflammation inside the blood vessel causing heart attacks and stroke. Gratitude blocks toxic emotions like resentment and anger, which can destroy our happiness. It is not possible for somebody to be grateful and angry at the same time. Successful gratitude practice starts with recognizing what we are thankful for and to whom we are thankful, and acknowledging it and appreciating it. Experts in the field in this field recommend that writing down a list of gratitudes daily in a book will help us to remember it and benefit us. It is also recommended to set some time aside every day to recall moments of gratitude associated with ordinary, simple things in our life. Research has shown that some important scientific facts about gratitude. Keeping a gratitude diary and writing down the things for which they are grateful for 2 weeks resulted in 28% reduction in stress and 16% reduction in depression in a randomly selected group of physicians who agreed for this study. Grateful people had 23% less cortisol, stress hormone level. 2 gratitude studies, one counting our blessing daily and writing a gratitude letter to ourselves, not sending it, reduced depression by 41% over a 6-month period in a large group of depressed patients. Daily gratitude practice can reduce neurodegeneration in the brain in older people that causes memory loss and Alzheimer's disease. Older adults, when given a neuropeptide hormone called oxytocin, which is possibly related to better social behavior, love, affection, and romance, showed 12% increase in gratitude compared to those given placebo only. In diabetic patients who practice gratitude had a 13% lower hemoglobin A1C, which is the marker of the glucose control level. Gratitude resulted improved sleep in 76% of the people suffering from insomnia. Soon after my residency, I started working in a VA hospital near Chicago. VA hospital treats sick and wounded U.S. military men and women after they leave the military. This was a big hospital with a large number of inpatients and hundreds of outpatients. Most of them were former soldiers in the Vietnam War. Otherwise, many of them lost their hands, legs, eyes, and a few of them are paralyzed and severely disfigured. In the outpatient clinic I used to work, I used to treat a man who lost his right arm and right eye in the Vietnam War. But I found he was the happiest patient in the hospital. He was always thanking me and the nurses and was very grateful for the services given to him. One day I asked him the reason for his happiness in spite of his difficulties he was going through. He showed me a diary and he told me that he writes in that diary every day the reasons for him to be happy and grateful for that particular day. I took a look for a few minutes in his diary for a few days, and the notation I read was ever etched in my memory, what he wrote. Some of the writings went like this. Today morning I got out of the bed and walked to the door in my 2 strong legs. But it could have been otherwise. I know many of my companions lose both legs and they cannot walk. Today morning I ate cereal and milk and a very tasty banana with my remaining left hand. It could have been otherwise. I lost only one hand, but few of the people in the war, my colleagues, lost both their hands. Today morning I got out of my house and watched the beautiful sunrise and the colorful plants and flowers around. It could have been otherwise. I could have lost my both eyes, then I could have seen nothing. At noon my son came to visit me with 2 of my grandchildren. It could have been otherwise because there are many who have no one to visit them. Yesterday I slept in a room with the pictures of my family on the wall and a roof over my head. It could have been otherwise because there are many homeless people in the world. Today I am standing above the ground, but many hundreds, thousands who went with me to the Vietnam War are not standing, they are beneath the ground. I know I also will be under the ground one day, but till that day I will be grateful to my Creator and fellow human beings. After reading, I thought, yes, these were the most powerful lessons that patient taught me on that day, which I did not learn in any of the medical syllabuses in the medical colleges where I learned. This is Dr. Roy P. Thomas from Chicago. We'll see you again next week at the same time.
USA വീക്ക്ലി ന്യൂസ് പൂർണ്ണമാവുന്നു. നന്ദി, നമസ്കാരം.